only offer more government force. All these ignore the cause dating back to 1942. Before producing more mandates, fines, penalties, government should first offer the same tax exclusion to every individual. And that's our first step for healthcare reform in the private sector. Now, remember when we discussed that back in 1940, 90% of Americans were uninsured? Did that mean that 90% did not get medical coverage? Of course they did. At that time, access to medical care was not synonymous with health insurance, and it was generally affordable without insurance. Why is medical care not considered affordable today? Many think that medicine is more expensive today because of advances in technology. However, automobiles, telephones, computers all have more advanced, more powerful, and they've all become more affordable. Why didn't this happen with medical technology? So, the last symptom I want to cover is the high cost of medical care. Another consequence of almost 100% insurance coverage by the employer was that normal market forces were not applicable with health care. Patients generally did not shop for by price, but they only sought quality. And medical professionals had no incentive to cut costs, only provide quality. Between 1945 and 1965, this mentality took root. And by then, medical care was something that people expected someone else to pay for, the employer. And the model for that care was to do whatever was best without regard to cost. Since health insurance was tied to the employer, employees were faced with purchasing private health insurance when they retired. Many of them did, but some were not insurable. And they had to rely on their own resources or on charity. Up to 1965, there were charity wings in almost all the hospitals, and everyone got care. Even so, politicians considered this elderly, uninsurable issue a problem, and they wanted to solve it. Did they recognize this as a consequence of tying insurance to the employer, as a consequence of discouraging personal responsibility? Did they diagnose the problem? No. In 1965, Medicare and Medicaid was pushed through Congress by Lyndon Johnson, suggesting that it was degrading for the elderly and poor to be dependent on private charity. This is the charity of the doctors and hospitals that gave their care for free to them. And a means test is incompatible with human dignity. Thus, medical care when you are older will then be the responsibility of government. Thus, government, I believe, wrongly established medical care as a right for certain segments of the population. Now, how does the government secure this right? Financially, it set up what would be compared in the private sector as an illegal Ponzi scheme that taxes your children and grandchildren to pay for your medical coverage as you age. In addition, the politicians promised to have no control over the doctors or over their methods of care. All they wanted to do in 1965, they said, is pay the bill. So they established a cost-plus payment system that gave hospitals an incentive to purchase equipment, build new wings, and develop new treatments without regard to cost. Costs skyrocketed, with the underlying principle being that everyone's entitled to the best medical care that exists regardless of cost. How could it not? I would like to paraphrase here from a talk given by Leonard Peikoff to dispute the claim that it's advanced medical technologies that drive up cost. The normal pattern in a free market, exemplified by automobiles and the computer industry, is that a new invention is expensive at first, so that only a few can afford it. But inventors and businessmen persevere, aiming for the profits that come from a mass market. Eventually, they discover cheaper and better methods of production. Gradually, costs come down until the general population can afford it. No one is bankrupted, everyone gains. Ever since Medicare, when new inventions in medicine were discovered, such as kidney dialysis or liver transplants, they became immediately available to everyone by right. Simply invent the next cure or machine and then sell it to all the hospitals. There's no incentive for innovation to focus on reducing costs to establish that wider market. The market is there as soon as you invent it. This is not fraudulent on the part of the inventors. This is precisely what Medicare was set up to do. But what Medicare was set up to do is wrong. It was wrong to establish medical care as a right and use the force of government to tax one person for unearned benefits of another. and then to pretend that this is an insurance system. Medicare's introduction into the market raised the cost of hospital stays and began to affect most of the private insurance. Companies began to notice a 20% inflation in their insurance rates. And government stepped in to help by establishing PPOs and HMOs to reduce the costs and reduce the choices, and to reduce and incentivize the doctors to provide fewer services. Now, even Medicare noticed that its costs were out of control. But did they question the principles of their system? Did they diagnose the problem? No. They just abandoned their commitment to just pay the bill and to leave the doctors alone to practice medicine. They created 200,000 pages of regulations and controls on doctors and hospitals and hundreds of government agencies, all addressing symptoms, none fighting the disease. Thomas Jefferson: I predict future happiness for Americans if they can prevent the government from wasting the labors of the people under the pretense of taking care of them. Do you know how much 200,000 pages of regulation is? This ream is 500 pages. 400 of them stacked from this table would reach over 73 feet. That's 7 stories of regulation. Wasted labor under the pretense of taking care of us. At this point, I would like to summarize the history in principle. We discouraged personal responsibility starting in 1942. Consequently, we eliminate a free market in medical insurance with employer-based third-party care. And we further destroy the creative capability of individuals and markets to produce efficiencies by introducing Medicare in 1965, effectively eliminating free market economics in all of medical care. As costs spiral out of control, we begin to take away the freedoms that Americans also enjoy. We restrict patient choices of doctors and hospitals. We tell doctors and hospitals what to charge for their services by law. We force insurance companies to write policies to state-mandated benefits and force them to guarantee issue. We restrict building of new facilities with certificates of need, etc., etc. 200,000 pages. Freedom of choice is unsustainable without personal responsibility and free market economics. In essence, our patient, the body of the American medical system, is riddled with the infection of government force everywhere. And the concept of individual rights? Well, when it comes to medical care, that's been abandoned. Historically, there is one system that produces the best value: capitalism. It is based on the idea that individuals can trade with each other freely. Government supports the contracts made between individuals, but governments do not write those contracts. As we think about all the government interference in our lives and the mess that is made of medicine, let us recall Washington's statement about government. Government's not reason. It is not eloquence. Government is force. Like fire, it's a dangerous servant and a fearful master. Is the government acting as our servant in all these areas, or as our master? I contend that we have a wildfire of government force reaching into all aspects of our lives, slowly and insidiously destroying the things we value. I believe it's time we put the fire out, and I welcome you to join us. Thank you.